Hi, everybody. Thanks so much for listening. If you have decided to tune in today, I am Stephanie Morris, CEO of Shape America, and I am here with my amazing colleague at our partner organization, Health Resources in Action. And I'll let you introduce yourself, Brittany.
Thanks so much, Stephanie. And hi, everyone. So wonderful to be with you all today. Thank you so much for tuning in. My name is Brittany Chen. I'm the Vice President of Health Equity at Health Resources in Action. And I'll be telling you a little bit about our organization in just a little bit.
So with that, we are here today as partner organizations because we are really excited to have recently been awarded funding from the Centers for Disease Control and Prevention, CDC, for their next round of cooperative agreement funding, which in our case will fund the National Health Equity Initiative. Really, really excited about this work. But before we get into what the initiative is and what that all looks like, we're going to tell you a little bit more about just who we are as an organization in terms of Shape America and Health Resources in Action. So with that, for those of you who are listening who are not as familiar with Shape America, we are the National Physical and Health Education Organization for all teachers in the K-12 space. And that certainly includes our higher education colleagues who are working in teacher education programs for health education, teacher preparation, and physical education teacher preparation, as well as anyone who's working in the higher education field in ways that support advancing HPE in our schools. So we are the voice for more than 200,000 HPE professionals across the country. We have a wonderful, diverse community of health and physical educators, advocates, supporters, and more than 50 state affiliates. And since our founding in 1885, we have defined excellence in physical and health education through the standards that we maintain, the national standards, both for physical education as well as for health education in schools. So that's Shape America. Now I get to turn it over to Brittany to talk a little bit about Health Resources in Action.
Thanks so much, Stephanie. I am excited to introduce us to you as an organization. We are Health Resources in Action, HRiA for short. HRiA is a national nonprofit public health institute, and we're based in Boston, Massachusetts, but we do work all over the country. And we are dedicated to helping people live healthier lives and creating healthy communities through prevention, health promotion, policy, and research. And at the center and the heart of everything that we do, we are committed to advancing health and racial equity, ensuring that all people attain and experience optimal health and well-being. And so for decades, we've worked to improve the health and well-being of youth and families in all the places where they live, work, learn, play. And so this, of course, includes working with educational leaders at the school, the district, the state, and the national levels. And we do a lot of work in the out of school time space as well. And through all that work, we really aim to identify where health and educational inequities lie and try to grapple with and uncover the root causes for those inequities. And ultimately, the work we do in partnership with many is for to the effort of advancing more equitable policies, practices, systems, and environmental changes. And just to give a little bit of give some examples of the school health efforts that we have been engaged in over the years. We have been really involved in integrating and amplifying youth voice in school and district wellness councils and policy development, promoting healthy and active school environments and policies, working with partners like Shape America to foster a deepened sense of belonging by students in the educational workforce through addressing equity, diversity, and inclusion in education, and of course, so much more. And so that's just to give you a little flavor of who we are as an organization. And we're just so delighted to be working in collaboration with Shape America on this exciting cooperative agreement.
Thank you, Brittany. That's an awesome introduction to your amazing organization. And it's also a really great segue into talking a little bit about the opportunity we've had to work together in the past and the opportunities we have to build on all of that as we move forward. So why don't you share a little bit first, if you don't mind, about the work that we've done together in the past and how Health Resources in Action, what role you've sort of played in that work.
Absolutely. Thanks, Stephanie. So I just have to reiterate, HRiA is so excited, so honored to be able to partner with Shape America on this initiative and really thinking about school health and health equity and how do we bring those spaces of work together. We've had the distinct honor of working in partnership with Shape America for the last 4 years on promoting active school environments. And our partnership has really grown in 2021 through close collaboration on a series of facilitated roundtables that led to the development of strategic action plans for advancing equity, diversity, and inclusion in health education and physical education spaces. This cooperative agreement is such an exciting opportunity to build on the momentum of those conversations to bring these efforts into further fruition as we engage school administrators as equity champions for healthy schools. And so we just see this as the natural next step of a lot of that work that we started with you all in these last few years and are excited to see where it leads us.
Yeah, and I just have to chime in and say, especially this work that we did over this past year that you helped us do in facilitating roundtables led to such meaningful discussions about the importance of equity, diversity, and inclusion in our HPE community. And it really helps so many individuals see a place for themselves in leadership conversations and in ways to engage with our national organization that they hadn't seen before. And that has had such a tremendous impact in all that we are doing and in the different ways we are able to serve, because those individuals are so excited to continue being engaged with us and to continue contributing towards this shared mission of advancing EDI and health and physical education. So it's been really rewarding. It's so exciting to see the impact of all of that work sort of play out. And we just echo everything you said about being really excited to build on it as we move forward. So along those lines, let's pause for a minute and talk about this national initiative to advance health equity in K-12 schools. What exactly is it? What will we be doing together? I'm sure that's a question many people have as they're listening to this. And first and foremost, what we're really excited about is the opportunity to engage school administrators in helping them understand the importance of supporting strong standards-based physical education and health education programs in their schools. I have to say, I have seen firsthand in my opportunities as CEO of Shape America, when I've traveled to different states and visited different schools, I have seen firsthand the absolute difference it makes when a school administrator is actively supporting their school's physical education and health education teachers. It makes a world of difference in the culture and climate of the school community, and it definitely has an impact on fostering health equity throughout the school, which then leads to improved learning outcomes, improved family engagement, and overall culture of wellness in their school and in their district. It is tremendous. And so I think our question at Shape America has always been, how do we achieve more of that, right? How do we reach more administrators? Because we know they're hard to reach and engage. Every administrator is dealing with day-to-day challenges in their lives, in their profession as a school administrator. And so how do we reach them and educate them and engage them to be stronger supporters of what we know students need, what we know our teachers need? And this initiative, through the opportunity to form online learning collaboratives, cohorts, to provide peer mentoring, to provide resources, to help administrators improve physical, mental, and emotional health amongst their students, amongst their school staff. That's what this initiative is going to achieve over the next 5 years. It is tremendous. We have it's like the dream proposal that you just can't be more excited about being able to implement. And of course, Health Resources in Action is going to be a very close partner in doing all of this work over the next couple of years. So I'll pause, get really excited in talking about all this, and I'll let you chime in, Brittany, about the role that HRiA will play with all of this.
Thanks so much, Stephanie. I think your overview was perfect, and I can't reiterate enough how exciting this opportunity is to really make an impactful difference in this school health space. So at HRiA, we just look forward to working with Shape America in deep collaboration and providing the dynamic and interactive trainings that Stephanie, you were mentioning, building relationships and connection among educational leaders across the country, and building that support network and learning network amongst all of you. and engaging school administrators in practical and actionable community of practice conversations. And of course, amplifying both best practices as well as those innovative solutions to advance equity through policies, practices, and programs. We look forward to learning from all of you. Let me just put that out there right now. We are excited to deepen our own passion as a team, our own commitment to this work, and learn from the educational and community partners that we are going to be able to get to know throughout these next 5 years. And for those of you who we already know, but we'll get to deepen in partnership with. And ultimately, we just look forward to building towards lasting and more equitable change.
You couldn't have said it better. That was perfect. Thank you so much, Brittany, for your time and joining me today to talk a little bit about this incredible national initiative ahead of us. Thank you to everybody who is listening. And if you're excited to learn more and get engaged with us, I encourage you to reach out because, as Brittany said, we are ready and excited to be learning from you, our community, as well. So thank you all for listening. And Brittany, I'll let you sign off as well.
All right, thank you all. And I look forward to all the great work that's to come.
Likewise. All right. Goodbye, everybody. Thank you so much.
Bye, everyone.